Hello, welcome to any community. In this particular video, we are going to discuss the visible peristalsis, one of the important findings observed in per abdominal examination. When you think about the visible peristalsis, that is usually observed in the abdominal region, that may be in the form of left to right, that may be possible, or right to left may be possible, or in the abnormal ladder pattern that can be possible. So we are going to look into those aspects in terms of the diagnosis of the disease as such. As we have discussed, it is one of the inspection findings of the per abdominal examination, and it is indicative of a obstruction at the alimentary canal level, maybe at the level of pyloric antrum, or maybe at the level of small intestinal obstruction, or maybe at the level of a transverse colon. Look at this particular video carefully. Here we are going to see the movement of the peristalsis from left to right. Observe again left to right. This is indicative of a pyloric stenosis. Then, next, regarding the this is the one where we are going to see the ladder pattern, that too in the irregular form. Yes, you can observe from the frequently you are observing movement of the peristalsis from left to right, that too in the lower abdomen. So that is not in the lower abdomen, it is in the nearly around the umbilical region as such. This is indicative of a small intestinal obstruction. We are observing the peristalsis movement. If the movement is observed from right to left, that is indicative of a transverse colon obstruction. To sum up, visible peristalsis is one of the important inspection finding of a per abdominal examination. It indicates the obstruction at the gastrointestinal level at different locations. Suppose if they are observing the movement of the peristalsis visible from left to right, that indicates pyloric antrum obstruction. And if you are observing the ladder pattern in the abdomen, between the umbilical region, etc., then we are going to say that there is a small intestinal obstruction. And if you are observing the peristaltic movement from right to left, that indicates large intestinal obstruction. That's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one video that you'd like to hear in the coming days in this particular channel? Mention in the comment box below, and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.